Disease prevention and control. For disease prevention and control, knowledge of disease is required. That is, the source of infection, dynamics of transmission, multifactorial causation, time, place, and person. Coming to the source of infection and reservoir, first we need to control the reservoir by early diagnosis. Early diagnosis by lab investigations. It is needed for treatment to study the time, place, person, for prevention and control, for epidemiological investigations to trace the source of infection. Then we need to notify the disease. It is by lay workers, physicians and teachers. It is notified to the local health authority. Notifiable diseases are mostly communicable ones, which are of great concern to the public health. Next, epidemiological investigations are done for geographical distribution, climatic condition, social, cultural, behavioral patterns, and to know the character of agent, reservoir, vectors, vehicles, and susceptible host population. Then, isolation. Isolation is for period of communicability. Isolation is nothing but the separation of the infected persons for period of communicability from others in places where it limits the transmission of the infectious agent. Hospital isolation is better than the home isolation. Smallpox was eradicated based on ring immunization. That is, infected persons are encircled by the immunized persons who cannot spread the infection. And the isolation is done for 6 hours in case of meningococcal meningitis, streptococcal meningitis, and 3 days for cholera, measles and influenza from the onset of rash, and 6 days for herpes and chickenpox, 3 weeks for hepatitis A and TB, 4 weeks for pertussis. And treatment. Treatment may be given by individual treatment or mass treatment. For mass treatment, example is trachoma. Treatment is to kill the infectious agent. It decreases the period of communicability, duration of illness and secondary cases. Quarantine is to limit the freedom of movement of the infected person for not longer than the longest usual incubation period of disease to prevent his contact with those not exposed. It can be applied to sheep, aircraft, trains, vehicles. It may be of 2 types again, absolute and modified. Absolute is the one to totally limit the freedom of movement, whereas modified is the one partial limitation of the freedom of movement. Example, exclusion of children from the school. It is differentiated from the isolation. Isolation is the separation of the person for period of communicability, whereas in quarantine we are limiting the freedom of movement. Then comes mode of transmission. We have to interrupt the modes of transmission. Like modes of transmission are water, food, vectors and all. Water can be interrupted by just simple chlorination. Next, food. Foodborne diseases can be interrupted by breaking the chain of transmission by clean practices like hand washing, adequate cooking, refrigeration and covering the foods. Vector-borne. by destructing the stray dogs, control of the cattle, pets or other animals, and breeding places are treated with insecticides, pesticides. Then come to susceptible host. We have to give the active immunization for the susceptible host. It decreases the risk for those who were not vaccinated previously, and mass means of protecting greatest number of people by decreasing the susceptibility. It's nothing but the herd immunity. Though it's not 100% effective, if exposed to large dose of pathogenic organisms, it can decrease the risk a little. Active immunization can be given to yellow fever, cholera, plague, influenza and typhoid. One dose is given for yellow fever and typhoid. 2 doses are given for cholera, plague and influenza. And cholera is given by orally, 2 drops. Yellow fever by subcutaneous. Plague, influenza and typhoid by subcutaneous or intramuscular. The 2 doses can be given between 7 days to 6 weeks apart, whereas in plague it can be given between 7 to 14 days apart between the 2 doses. Yellow fever gives protection for 10 years. Typhoid is again of 2 types. It can be given as typhoid polysaccharide or oral typhoid. Typhoid polysaccharide can be given as 1 dose and immunity starts after 7 days, whereas oral typhoid can be given on 1st, 3rd and 5th day. After 7 days of 3rd dose, immunity starts. Thank you.